Onc Live Insights is a video editorial program produced by Onc Live.
One of the effective targeted agents in patients who have advanced pancreatic neuroendocrine tumors is everolimus. Everolimus is an mTOR inhibitor, and in genomic studies, some patients who have pancreatic neuroendocrine tumors have mutations in the mTOR pathway. That was one of the suggestions that was one of the observations that provides some rationale to use mTOR inhibitors in pancreatic neuroendocrine tumors. As it turns out, even patients who don't necessarily have mutations in those pathways can still benefit from treatment with mTOR inhibitors. So there are probably many different reasons to use mTOR inhibition in pancreatic neuroendocrine tumors. We know from the RADIANT-3 study that everolimus is quite effective in improving progression-free survival in patients who have advanced pancreatic neuroendocrine tumors.
The data for the use of everolimus in pancreatic neuroendocrine tumor really comes from the RADIANT-3 study. So this was a placebo-controlled phase 3 study comparing everolimus versus best supportive care and matching placebo. The study showed a significant improvement in progression-free survival, with the median progression-free survival being 4.6 months in the placebo arm and 11 months in the treated arm, corresponding to a hazard ratio of 0.35 or a 65% reduction in the risk of disease progression. More updated analysis has also looked at overall survival, and here a similar increase in median overall survival was seen, with the median overall survival being 44 months in the treated arm. Because this study had a planned crossover, almost all the patients on the placebo arm also crossed over to receive open-label everolimus. Therefore, the overall survival comparison is difficult, and the straightforward comparison is not statistically significant, as the study is not designed for that purpose. Nonetheless, a RPFST analysis, or rank-preserving structure failure time analysis, was conducted and suggested there may be a greater degree of overall survival advantage than what is shown by the straightforward Kaplan-Meier analysis of the data. I would use everolimus in patients with progressive pancreatic neuroendocrine tumors, with those who are symptomatic with more heavier disease burden. In terms of selecting which targeted agents to use in patients with pancreatic neuroendocrine tumors, there's really no head-to-head comparison. Although I would say probably the quality of data from the RADIANT-3 study is a little bit stronger than the sunitinib study. This is because in the sunitinib study there was an unplanned interim analysis and early termination. So despite the small p-value, actually the study did not achieve statistical significance in the PFS endpoint. For everolimus, there was no interim analysis, it's just the final analysis. So the data is quite robust in terms of the magnitude of the benefit as well as the statistical significance. Now that when you have a patient in front of you, another factor that may help you to choose which treatment to begin with may well be the safety profile. So in patients who have potential problems such as hypertension or history of cardiovascular disease, heart failure, definitely I would say I would favor everolimus. In patients with uncontrolled diabetes or, for example, oxygen-dependent COPD, then potentially sunitinib may be a better choice. And in patients who have functional tumors, there's also favors the use of everolimus, because the phase 3 trial also showed that not only everolimus delayed disease progression, but also reduced the tumor-secreted hormones from these pancreatic neuroendocrine tumors. The data for gastrin and glucagon are quite strong there. And there are also a lot of data to suggest patients with metastatic insulinomas who have hypoglycemia, everolimus can be quite good in terms of controlling the malignant hypoglycemia among those patients.
Everolimus was approved for use in patients who have advanced pancreatic neuroendocrine tumors in 2011. after the results of the RADIANT-3 study became available. That study showed that everolimus significantly improves progression-free survival. So we generally think about using everolimus in a patient who has an advanced pancreatic neuroendocrine tumor and has evidence of disease progression. So if you see that the tumors are growing, everolimus is a great choice to try to slow down the tumor growth, and in some cases you can even get tumor shrinkage. So the Leonis study was really an observational study that looked at patients who had neuroendocrine tumors and were treated with everolimus. And what it showed is that everolimus really is fairly well tolerated. Patients tend to be fairly compliant with it. And at least in this observational study, the data with regard to progression-free survival was quite consistent with what was observed in the prospective registration study for everolimus. It shows that this is a beneficial drug. It is generally well tolerated by patients, and it's something that really is being commonly used by oncologists to treat this tumor.